Hello everyone and welcome to another episode of BAEP Talks With, where we speak to a person of interest who either has P.C.O.S. or endometriosis, or a person who works closely with these women. I am Jasmine Evelyn, the president of the association, and today I'm joined by Saadiya Nakhuda, who is a medical esthetician. Thank you so much, Saadiya, for joining us.
Thank you. Thank you for having me.
Yeah, so I'm going to introduce you to everybody and then we're going to jump straight into the questions, okay? So Saadiya has over 10 years in the beauty, skincare, and medical aesthetics industry with a history of personal experience while on her own skincare journey. A scientist at heart, which I know, particularly in the fields of biochemistry and microbiology, she received a double major at the University of the West Indies Cave Hill campus in 2005. Saadiya's practical approach to skincare includes ensuring that patients' skincare regimens and treatments are specifically and specially customized, not only with their biochemistry in mind, but also with their lifestyle, which is important because some people don't want to do the, million steps and you have to cater for that.
And they don't need to, so yes, right. I work with you.
Yes. Her clinical approach to result-oriented outcomes are based not only on addressing the skin's symptoms, but treating actual triggers caused by addressing underlying imbalances that contribute to skin conditions, and by looking at the skin as it is, an entity in an overall codependent and connected network of other systems. Perfect. So Saadiya, tell us first of all, before we jump into specifically talking about P.C.O.S. and endo and what you do for those, tell us a little bit on what is a medical esthetician?
Okay, so a medical esthetician differs from an esthetician specifically, not just on services offered and the depth at which they treat into the deeper levels, but very much so regarding their background and training. Mm-hmm. It is very medically oriented. Like you would have mentioned, mine would have been biochemistry and microbiology, essentially pre-med. Mm-hmm. And I work, what differentiates a med spa from another spa would be working very closely with a medical entity or a doctor as well. In this case, I work very closely with Dr. Jamila Ford, very highly certified, accredited, trained. She has over 9 years of med school, 7 years of practice, and this is all at 29. She's
killing it.
So we made quite a little team. Yeah. But in terms of medical aesthetics specifically, it also comes down to combining non-invasive with minimally invasive treatments as well. So they're a bit more in depth.
Gotcha. Okay. And what led you to this career? What took you down this path?
So as I also mentioned, my own journey with skin, which very ironically comes out of the reason we're having this chat today. So just a little bit about me in general. Mm-hmm. I have forever been on the pill for regulation. Mm-hmm. And whenever I tried to take myself off in the past, it was just a vicious cycle. And of course, with that comes all of the skin conditions. And it would have been when I had finished university in 2005, started working, and I had this drastic flare. It would have been a few months since I had tried to take myself off of the pill again. I just did not want to be dependent on it. And skin just went to crap essentially. And it was a very low moment for me. And I would have just finished my degree as well. And I just thought, given what I know, there is no reason why my skin should be looking like this and why I cannot sort this.
Right.
Without medication, or in combination with, if that is the route that you do need to go, because sometimes it does have its place. And after antibiotics not working, being advised to go on raw Accutane, I was just like, I need to sort this out. And it was just a hormone imbalance, and there was no magic formula, or maybe this is the formula. I just brought myself off of the pill because I was just basically done with that, because in 2005 to 6, I had to go back on. and I was just done with it. I was a different Saadiya as well as versus the Saadiya who would have tried to come off of the pill before, more in tune with the universe, my own energy. And in that time, I was working more on my feminine energy as well, which is something that I really had not done in the past. And obviously, that will affect your hormones as well. I know it's not very clinical, it's not very scientific. I tend to spiritual as well, and maybe it's more scientific than we think, because energy is energy, it's everything. And, since then I've had a regular cycle. My skin has been amazing, thank you. And I'm a lot happier with myself in general, because obviously taking a hormone treatment would have been affecting my mood, everything. It affects everything, things you don't even think about.
And with that being said, when your hormones, and as we know, so it's P.C.O.S. Awareness Month now in
yes,
and we know that your mood and how you feel, your mental health is so linked to how those hormones are, the balance of those hormones.
Of course.
And on top of that, yeah, and then when those are affecting your outward appearance, as much as people say, oh, it's just how you look on the outside. No, it can really affect how you feel.
That affects how you feel. And let me tell you, when my skin cleared up, I was a different Saadiya. You couldn't talk to me the same way, huh?
And I think, you know, a lot of people can identify with that.
Yeah, but it also affects, especially as a woman, what you think about your future. And even just seeing my patients and my clients when they walk back in here after a consultation, it's like a different person walking in. They're dressed different, smiling, a little pep in the step. And when you start feeling better about yourself, you send out that energy, you attract differently, you start doing more, you walk more in your purpose.
Yes.
And that essentially is what led me down this road.
Yes, to help others.
Yeah. And I've worked on the very clinical medical side of it as well. I was a med rep with Galderma for the OECS and some of the Larger Antilles for quite a few years. And I can appreciate that side of it as well, but it can't come down to just taking medication. Like, nothing works if you don't. What are you doing? Not just for skin, but overall health in general, because your skin is a reflection of your overall health.
Yes, which we kind of touched on at the end of your bio, which I thought was important, is an outward reflection of what's going on the inside.
Of course.
Yeah. So tell us a little bit about the services, because we are focusing on, we're going to talk about both P.C.O.S. and endo, but since it's P.C.O.S. Awareness Month, tell us a little bit about what you offer specifically for, because no, P.C.O.S. is associated with hirsutism, the excessive hair growth. And sometimes, you know, it can also be associated with acanthosis nigrans, which would be the hyperpigmentation in those creases in the neck and so on. So what do you offer for those? And anything else I might not have thought of for women with P.C.O.S.?
Okay, so the thing is, I'm going to be a biochemist right now.
Here we go.
Don't worry, I won't get too technical. But the those are mutually, they're not independent of each other. The same condition or the same biochemical factor that codes for the hair thinning will also, in some places, because some women do experience hair thinning of the scalp, but they will then in turn also experience hair growth in other places, basically places that males typically experience hair growth. And it comes down to the hyperandrogenism, the rise of the androgens or male hormones, and that would be responsible for the patches as well, or play some role in pathways that lead to it. So, I mean, we do offer hair removal. You will be treated with the Irrelase laser, also specially designed to treat darker and more ethnic complexions as well. It doesn't just address hair removal, it will also address your pigmentation, skin tightening, rejuvenation. Nobody says no to that. And kills the bacteria in cases where there will be infection as well. In terms of the pigmentation, we will offer that also. But you know, we can combine that with peels. I'm a combination therapy person. Like, you're not just going to be lasered and sent out. Like, what are we doing after? In terms of hair restoration, myself, once again, and Dr. Ford, we do work together to either offer scalp mesotherapy or PRP treatments for hair restoration. But what is
mesotherapy and PRP?
Oh, sorry. So PRP Mesotherapy is basically the delivery of material into the mesothelial layer of the skin. So injections. We have a special serum cocktail for those people who may have blood conditions where we cannot use their blood or they simply don't want to. And PRP would be the platelet-rich plasma from your, so we separate your platelets from your blood, which is basically what is dedicated to your healing. And you'd be surprised how much of your blood is dedicated
So you would take blood from the patient.
And healing. Yeah, so we extract your blood, we do a blood draw, and then we extract your blood with a centrifuge. And it needs to be the perfect mix of, because you need to separate based on size, but your platelets are neither the heaviest nor the lightest. We also need to make sure that in that separation, you don't have more of a white blood cell count than is necessary, because then you will trigger too many inflammation pathways, which are unnecessary. So it's just 80% yield essentially, but what is important is that in a 10 ml draw of blood, you can get up to 6 to 7 mils of plasma. Most of your blood itself is designed to your own immunity, protection, defense. Yeah. And then we will use that and inject by a special gun, because I don't believe in microneedle in that, or sitting down with a syringe. We'll both be fed up of each other after a while. Use a meso gun. It also ensures that, unlike microneedling hair, it won't damage the proper hair that is there that you're trying to keep. And it just makes it a bit more comfortable. I mean, I've done it to myself without anesthetic. So,
so yeah. So sometimes, a lot of times people will say, well, they're scared of lasering because it's going to be painful. What would you say? I know I'm one of your clients, and so I've been treated by you for my skin and also lasering, so I can attest to the fact that it's not overly painful. But what would you say to somebody?
Sometimes.
Yeah, what would you say to somebody who is interested in lasering but they're scared?
So one of the benefits of using the airlays, aside from no touching, which is really important right now, because most lasers you need to plant it down on the skin, which is what really increases the risk of burn and making it uncomfortable as well. So it's no touch, it's a light passover. And because of the way there is a very scientific definition for why it is less painful, but basically the pulses and the depth have to do with it. And it's actually more effective with less risk than your typical laser as well.
Oh yeah. Okay, so I did not know that others touch the skin. I just took for granted that they're all like that. Okay. And when people ask about laser, they wonder, like, how many sessions am I gonna have? It doesn't have to do for the rest of my life. Like, just give us a little bit on that, so like our viewers know well what to expect.
So same thing for hair restoration. Typically, well, with laser hair removal, like 8 to 10 treatments every 4 weeks. However, once again, it's not a cookie cutter approach. Every 4 weeks, yeah. Because remember, each strand of hair is in a different cycle of growth as well. Otherwise, as you said, we'd all be bald intermittently or routinely. But because this is not like typical hair removal, like say from your arm or wherever, and it's coded very specifically by hormonal changes, what I would recommend is to do at least 6 of those. And then we'll see where we are, because you will probably need more than the 8 to 10 treatments, but what we can do is give you a bigger interval, because we can't approach it like we would typical hair removal, because it's not typical hair growth.
Right. Okay, cool. Now, I know that you've introduced a new kind of modality into your practice, ozone therapy. Tell us a little bit about that. Tell us exactly what ozone is, and then let's dive in.
Okay, so I would have come across, or my interest would have been generated in ozone therapy and just working with skin, facials in general. I always knew what it meant for the skin with my biochemistry and microbiology training, but like it would have piqued my interest more and more as I really got into my skin and body treatments. Sorry, face and body treatments, skin in general. So ozone, as we know it, would be the protective layer around the atmosphere. It's a gas protective layer around the atmosphere, and it's been recovering recently. Yay!
When I hear ozone, I'm like, when I first heard ozone, my mind didn't compute. But yeah.
So oxygen, as we breathe it, would be 2 would be O2, ozone is O3. So the chamber actually splits the oxygen and allows it to reform into the three oxygen atoms, forming a molecule of ozone. What that does is really oxygenate the body to deeper levels. And why that is really important is because a characteristic of any chronic condition, disease, whatever, comes back down to low oxygen or lack of oxygenation. But aside from just flushing the body with oxygen, what the ozone chamber, what the ozone does, it's a sauna, so there's heat involved, but what it really does, it's a number of cascades and a number of advantages that one can benefit from. So, but as I was going on to the next step, it's also a regulator of the immune system. And it doesn't just activate it, it regulates it. So in the case of autoimmune conditions, which can be prevalent in P.C.O.S. and endometriosis, specifically a lot of dermatitis type presentations, in the cases where it may be overactive, it can help to downgrade it, so it's a little bit less active. But what is really important, once again, I'm not going to get too biochemical, but an important factor of the immune system is the production of TNF, tumor necrosis factor. And aside from what that means for cancer, is that it basically, trying to simplify this, it basically triggers the cascade of immunoresponses that are responsible for protecting you when necessary. So it increases TNF, or tumor necrosis factor, allowing the pathways as your body needs them to conduct whatever pathway is necessary for whatever type of protection may be necessary. So, and endometriosis and P.C.O.S. are both characterized now as the real disease is inflammation. As with most other cases, the real disease is inflammation.
And so how does ozone therapy help with to be more anti-inflammatory?
Right, so I'm gonna get to that. So, but what the characteristic of both, not just being inflammation, is also poor immune response. Whether it be cell proliferation, especially in endometriosis and P.C.O.S., where you have the cysts forming, or an endo attachment to other areas where they shouldn't be. And that is important, not just in increasing the metabolic rate of cells, but proliferation and also cell death when necessary. So it works together with the immune system to do that. Another factor where it comes into play is two processes, angiogenesis and neovascularization. Neovascularization is the production of vessels in areas where they do not previously exist, where necessary. And angiogenesis would be the production from of capillaries from pre-existing vessels. But what this also means, aside from improved circulation, is improved oxygenation. And the mistake commonly made in treating the two, endo and P.C.O.S., is that it's treated like it is a disease of a single therapeutic area or just a single entity, whereas everything is connected.
It's a holistic approach, is definitely.
Exactly. Like, I mean, typically, especially like, well, in the case of both, hormone treatments are prescribed, but that doesn't really stop the actual problem. And my approach to everything is treating it on the cellular level. What it also means is that it allows for DNA repair within individual cells. So when individual cells repair, they produce improved cells, and just avoids it going on that road altogether. Yeah.
Good.
Ozone, it kind of, and it basically what it does is initiates your own body to function to the best of its ability, whether it be the immune system, circulation, oxygenation, getting rid of the pathogens. And that is just some of the ways in which ozone works.
Right. And what about pain? Does it help with pain relief?
Yeah, yes, it helps big time with pain release, not just on the biochemical level and sorting stuff out, but on the physical level, the relaxation, it helps with depression.
Because you know it would have come late yesterday, and we had a
very good sleep.
And I felt like my shoulders, you know, really because of the heat and everything, it really caused my muscles to relax. It's really good to get a good sweat. I found that was really relaxing.
And another way that would have worked is by improving your lymphatic system. As you know, anybody who has a compromised lymphatic system has compromised health. So it kickstarts that, gets everything going, flushing out the toxins like it should. I mean, let me begin by saying I'm not a fan of the typical detox, Like I'm not going to drink tea and sit on the toilet for the weekend. So, but if you can talk to me about detox on the cellular level and repair, then I'm down for that. And that is what it flushes out all of the stuff that would have been, you know, the heavy metals that you would have ingested, whether it be from the pot you're cooking with, whatever, just the environment in general. It's not what it used to be.
When I was in there, I was thinking of persons with especially chronic pain. It would be a good chance for their muscles to, you know, get a relax.
Yes, so it's actually used as an adjunct therapy with arthritis, basically, and any other therapy. Yeah. And I just wanted to say, you know, I'm not also the type that would be you have to cut, because obviously inflammation triggers can come from diet as well, especially in the case of P.C.O.S, where you can have insulin resistant P.C.O.S. But I'm not going to tell you cut dairy, because dairy doesn't affect everybody the same way. It's very specific, and sometimes it's not dairy that you need to cut, it's the amount you need to control, and we all know when we're overdoing it. So yeah, that is going to be very specific across the board per individual as well.
What works for you, you know, is working out what works for you. And with having so many options for treatment, you know, this being one of them, ozone, whatever, being one of them, you can, having lots of options help you to pinpoint, okay, this is what works for me, this is what doesn't, and like kind of form your own management.
Exactly. And just being aware of yourself. Like my personal example, I just knew I could not have P.C.O.S. I wasn't presenting like it, and just be aware of yourself so that when changes do happen, you know what your normal is.
Yeah.
And what I do want to say is really good work with the stuff you've been doing, not just for the month, but in general. Because like I said, I remember how I felt when I was misdiagnosed, and I can just, you know, extrapolate that to how someone who actually is living with it feels. And it could be like, in that time I had put on about 15 pounds, and it was not typical for me. I wasn't eating any differently. I was overweight, my skin was awful, and it was very frustrating. So
you're very alone. So that is why we are trying to, you know, we form this association so that women realize, okay, wait, I'm not alone, I'm not making this up, it's not and here are all these resources and people who thought ahead of things that I might need, so that it's not difficult.
Because awareness is one thing, but then what next? What are you going to do? And women especially tend to tiptoe around these issues.
People in general, I won't even say only women, but people in general, to anything that they perceive to be, I guess, below the belt, because people consider things to say with periods, it's something that's tiptoed around. Is there any final words, anything that you would like our viewers to go away with from this conversation?
Well, I just wanted to add that it's not a panacea for diseases or anything. It's not a miracle worker. It's not, you know, but it comes in very handy. It's actually a standard in hospitals in Cuba, all very advanced by their own means, especially in the medical and technological fields. There are standards in those hospitals, but I'm not telling you don't go the medication route. I mean, just have informed conversations and make informed decisions with your medical practitioner. Thank you. Bye. Bye.